First of all, I would like to make crystal clear that several patients that are now currently selected for the diagnosis of brain death, they could be recovered to a normal daily life if they were not submitted to apnea test and they were given timely, updated, proper treatment. So this is something very important, and I would like to make that crystal clear. In other words, by performing those tests for brain death, those so-called diagnostic tests for brain death, we are killing patients to make sure that they are dead, which is nonsense. Back to 1968, physicians, medical doctors used to think that when we had no detectable neurological functions which is performed by the brain, the only possible explanation would be irreversible intracranial circulatory arrest. Back in 1968, we used to think that when all those so-called cephalic reflexes, when all those reflexes were no longer detectable, the only possible explanation is that the intracranial pressure had reached maximal values. That means that the blood vessels within the intracranial cavity were completely compressed and there were no blood flow to the brain. So they associated lack of function to necrosis, to irreversible damage to the brain tissue. Lack of function, no vitality. Okay? Mm-hmm. That's the concept, the pathophysiological concept that was proposed in 1968 to select the criteria to diagnose brain death. Mm-hmm. But later on, the progress of medical science demonstrated that when the blood flow is decreased to only half the normal level, those reflexes can no longer be detected, but the brain is still recoverable at this point. Mm-hmm. Within the range of 20 to 50% of brain blood flow, of the normal brain blood flow, the brain is functionally silent, but it's still recoverable. Some of those patients may have irreversible brain damage prior to those tests, but a large number of them may be recoverable up to that point. And when you induce a apnea test in those patients that up to that point could be recovered, they are no longer recovered.
How many percent can recover with the right treatment?
We know that some doctors, some neurosurgeons, including in Germany, some neurosurgeons have induced hypothermia in patients that have decreased consciousness, in patients that are in coma as a result of head trauma. Mm-hmm. And according to those results, they could, if they induce hypothermia, that means that they decrease the temperature down to 33 degrees Celsius. It means that they will decrease the temperature in only 4 degrees, okay, by 4 degrees. Mm-hmm. They could save up to 70% of patients to normal life. And another important issue is that nearly all of those patients are having decreased production of thyroid hormones. because the signal that comes from the brain in order to stimulate the thyroid gland to produce thyroid hormones, this signal is decreased as the blood flow is not normal, is partially decreased. If the blood flow is partially decreased to the range of so-called ischemic penumbra, which is insufficient to cause irreversible damage, if the blood flow is at that level, you will have decreased the levels of the hormone that stimulates the thyroid gland to produce its own hormones. Mm-hmm. That is a condition called hypothyroidism. Mm-hmm. And if you have decreased production of thyroid hormones, the respiratory centers will not respond to apnea tests. That's the second reason why the respiratory centers cannot respond to apnea tests in patients who are in deep coma. They have hypothyroidism, and it's now known that the level of hypothyroidism correlates with the level of coma. Mm-hmm. So that means that the most severe cases of head trauma have the most severe levels of hypothyroidism. Mm-hmm. And hypothyroidism is a lethal condition if it's left untreated. Those patients are not receiving proper, updated, timely treatments. Another important issue is that the lack of normal levels of thyroid hormones also increases what we call vascular permeability. In other words, patients having hypothyroidism will have increased brain edema. I mean, the brain will increase in size and it will cause further increase in intracranial pressure. Mm-hmm. That means that the blood vessels will be further compressed by the presence of hypothyroidism. And if you don't treat hypothyroidism in these patients, you cannot have the regression of brain edema. You cannot save those lives. Mm-hmm. Another issue is that exactly for the same reason, because you have partially decreased blood pressure and blood flow to the brain, you may also have decreased production of the hormone that stimulates another gland that is called adrenal gland. And without adrenal hormones, you will have low blood pressure. Mm-hmm. And the patient will die if you don't replace those hormones. So you have two lethal conditions, which is hypothyroidism and adrenal failure in patients who are in deep coma, for example, as a consequence of severe head trauma. Mm-hmm. Two conditions that would be lethal if they were isolated and not treated. Mm-hmm. And they are associated in the same person. Mm-hmm. So you have two lethal conditions that are left untreated in patients with severe head trauma. And those patients, instead of receiving proper treatment, that would be hormone replacement and hypothermic treatment, instead of receiving those treatments, these patients are submitted to apnea tests, sometimes once or twice, to make sure that they are brain dead.